Hello, my name is Darielle Dorset. About a month ago, I was in the Planned Parenthood office waiting for my cousin. She was 14 weeks pregnant and about to get an abortion. 2 hours later, she came out of the room still visibly pregnant. She said the doctors didn't want to do the abortion because it was late term and they were high risk. After that incident, I wanted to find out what were the high risks of late term abortion. And I also want to inform women who plan on getting a late term abortion and men and women who know someone who wants to get a late term abortion about the health risks. A late term abortion is an abortion done during the later stages of pregnancy. Usually it's done between 14 to 27 weeks of gestation. Gestation is the development of the fetus in the womb. Few statistics show that approximately 1 in 10 abortions are done late term in the United States. 14% of the women are under the age of 18, and 13.8% of them are between the ages 18 to 19. The first risk of a late term abortion is infection, and it's because physicians perform most late term abortion using dilation and evacuation, also known as D&E. Patients receive antibiotics before this procedure is done because of the possibilities of infection. Infection can occur due to unsterilized instruments introduced to the uterus. I'm about to show you a graphic photo of D&E done to a 23-week-old fetus. As you can see, a metal clamp is being used in the uterus to take out the fetus, and if the clamp isn't sanitized, it can cause an infection. And also, this is a possibility in this picture of remnants of a fetus left in the uterus, and that can cause an infection as well. Symptoms of an infection are muscle aches, headaches, dizziness, and an overall feeling of any illness. The second risk is sepsis, and it's a serious medical condition caused by infection, and it can lead to widespread clotting and inflammation. The symptoms to sepsis is fever, chills, severe abdominal pain, and smelling vaginal discharge. A third risk of late-term abortion is heavy bleeding. Now, after any abortion, a little bleeding is expected, but if you're bleeding heavily, or anyone you know bleeding heavily, meaning bleeding through 2 maxi pads, that's a sign of a tore uterus, which can cause hemorrhaging. And a final risk of late-term abortion is a ruptured uterus. Doctors cannot see the uterus while performing an abortion, so that causes a lot of health risks, like the tearing of the uterus. That's an important health risk. And if the uterus is pierced, surgery is done to close up the tearing. And in an extreme case, the uterus will have to be removed. Those are the 4 risks of late-term abortion. Again, infection, sepsis, heavy bleeding, and a ruptured uterus. And if you or anyone plan to get a late-term abortion, remember these health risks. And it can also be very expensive. Thank you for listening.